Hi, today we'll be talking about two compensatory strategies for dysphagia. Compensatory swallowing strategies are used to prevent symptoms of dysphagia in order to maintain a safer swallow. The two compensatory strategies I will be discussing today are head rotation, also known as head turn, and head tilt. Candidates for postural changes include individuals with unilateral deficits. For example, it could be a neurological impairment, a head and neck cancer resection, or other structural damage. Postural changes are good for all ages. The two postural changes techniques help move the bolus, which can be food, liquid, or medication, from the oral cavity and the pharynx, and it also modifies pharyngeal dimensions. The first compensatory strategy I will discuss today is head turn. This strategy is good for the oral and pharyngeal stages of swallowing. It's beneficial for unilateral laryngeal weakness, unilateral pharyngeal weakness, and reduced upper esophageal sphincter opening. For unilateral pharyngeal weakness, depending on the patient, the head is turned to the left or right side, typically towards the damaged side or the weak side. Although the opposite side may be attempted if there is limited success with the first side. The head turn directs the bolus from the stronger side of the lateral changes of the pharynx, and this closes off the weaker side. The unilateral laryngeal weakness, the head turn narrows the laryngeal entrance and increases vocal fold closure by applying extrinsic pressure, which may be beneficial for patients with reduced laryngeal adduction, which means reduced closure, in the case of unilateral vocal fold impairment. Reduced upper esophageal sphincter opening, the head turn allows for increased extension and duration of upper esophageal sphincter because of a drop in the upper esophageal sphincter pressure. So for example, I would say turn your head to the side as if you were looking over your shoulder. So if I have left side weakness, I would turn my head to the left, like this. Okay, so if you have left side weakness, what side do you turn your head to? Perfect, let's see it. Nice. This closes off the weaker side, keeps the pressure change adequate, and allows for a longer bolus manipulation, and it also pulls down on the stronger side. So our second compensatory strategy is called head tilt, and this is good for oral prep and mastication. So head tilt is beneficial for patients with unilateral oral weakness. The head is tilted towards the stronger side to keep food on the chewing surface of the stronger side of the oral cavity. This is different than head turn. You turn your head to the weaker side and you tilt your head to the stronger side. When you tilt your head, gravity helps pull the food down to the stronger side. So I would say tilt your head like you were touching your ear to your shoulder. So if I had left side weakness, I would turn my head or tilt my head to the right, for example. All my food is going to the right. Don't talk and eat. Let's see you. Good job. It should be noted that postural changes are not lifelong adjustments in swallowing. They are to be considered short-term compensatory strategies. It is also important to keep the patient's compliance, cognition, physical factors, or if they have any other swallowing deficits in mind, because it could interfere with how effective these postural changes are. So you have to keep those in mind when you are considering recommending any of these postural changes. The best way to identify if these postural changes are effective is with an instrumental evaluation, such as a fluoroscopic or endoscopic swallowing evaluation. I wouldn't recommend them until you know that they are effective. I use 3 articles to help back up my evidence for the head tilt and head rotation. The articles are Adult Dysphagia Treatment, Dysphagia Clinical Management in Adults and Children, which is our textbook, and Dysphagia Management in Acute and Subacute Stroke. And all the articles backed up and stated how and why these strategies are effective. If you have any other questions, feel free to contact me.